Welcome, doctors. Today we're going to talk about something stirring up a lot of conversations in medical forums and practice groups: ECW's AI-powered revenue cycle management. You've probably seen the pitch: AI automation for just $99 a month per provider. Sounds simple, right? But once you dig deeper, the story gets a lot more complicated. Here's what doctors are actually experiencing. To even access the so-called AI bundle, you first need to add practice management services from ECW. That's where the 2.9% of collections fee comes in. And only after that do you get the privilege of paying an extra $99 per month per provider. Now, many professionals are asking, is 2.9% even realistic? Most reputable US-based billing companies are charging 4 to 6%, sometimes even higher. So when ECW advertises 2.9%, people are understandably skeptical. Let's clear something up right away. Doctors and billing experts who've worked with ECW are saying the same thing. These bundles are more like AI-assisted tools, not fully autonomous AI. In other words, the system can flag issues, generate alerts, and help scrub claims, but you'll still need a biller, or even a full team, to follow up on underpayments, denials, and those weird cases with primary and secondary insurances. One consultant put it bluntly: RPA is not AI. Robotic process automation doesn't think for you, it just moves tasks around. And someone still has to babysit it. So let's break down the real total cost here. The base percentage fee, 2.9% or higher, depending on what you're quoted. The $99 monthly AI add-on. Plus, the salary of a billing specialist to oversee everything. And don't forget integration costs and ongoing troubleshooting. That $99 a month headline number? It's really just the tip of the iceberg. One of the biggest concerns doctors share is integration. A practice owner who used ECW's RCM services years ago said their patient accounts are still a mess today. Payments were misapplied, credits were showing up incorrectly, and staff had to jump between separate systems just to figure out balances. The most painful part? They had to write off patient debt because the system couldn't combine old balances with new ones. That's not just an annoyance, that's real revenue lost forever. And then there's the question of support. If ECW's EHR alone is already known for being confusing, how much more complicated is it when you add billing and an AI layer on top? Doctors are also comparing ECW to Athena and others. And the story is consistent. Even when you pay higher percentages, you still need a team of billers. One larger organization said despite Athena's RCM service, they had to keep 4 to 5 billers just to keep up. What doctors actually recommend? So what's the alternative? The advice from seasoned healthcare professionals is simple: find one biller you trust. Someone who works on everything, provides thorough reports, and doesn't make you split accountability between your staff and an outside RCM team. Many practices today are turning to virtual RCM specialists. These are trained professionals, sometimes even MDs, pharmacists, or nurses who work directly inside your EHR system. They combine AI tools with human expertise, so you don't have to babysit the technology. And the cost? Often under $2,000 a month for a full-time specialist. That's less than half of what you'd spend on local staff or percentage-based services. And the best part? No hidden fees. So, doctors, here's the bottom line: ECW's AI RCM isn't really replacing billers. It's more like an assistive tool with a confusing pricing structure, hidden costs, and some serious integration concerns. If you're considering it, ask yourself, are you ready to pay percentage fees, monthly add-ons, and still keep a biller on staff to manage the mess? Or does it make more sense to hire a trusted billing expert, whether in-house or virtual, who can actually deliver results without the headaches? Because at the end of the day, what we need in revenue cycle management isn't more confusion, it's clarity, trust, and expertise. Thanks for watching, and until next time.